Good evening, everybody, and thank you for coming. My name is Bill Jones. I'm co-chair of the Youth Task Force, along with Mike Joyce, who's in the back. And I'd like to introduce Jamie Vanderhoek, who is one of the two coordinators of the Youth Task Force, does yeoman's work in planning these kinds of events. This is our third year of having parent lecture series of topics that are really germane to the island around youth substance use and abuse. And we're pretty proud of the work that we're doing. And I thank you all for coming. Every one of you got one of these great bags. We're using these to launch our website. The official launch date is March 1st, but the website is up and running. Great resources for parents, educators, professionals, all kinds of links, and we'll take any ideas anybody has for expanding it even further. Also on there you'll find our Safe Homes Pledge, which is a program that we're running to assure that kids can have the opportunity to be in houses where parents are committed to not having kids drinking in their house on weekends or for any kind of gathering. So you can look at that as well. So I want to thank you again for coming, and I'd like to introduce Janina Kean. Janina is an island summer resident. She is on the board of the Vineyard House and is CEO of a treatment center in Connecticut. And when we've been getting her information, we think the topic she's talking about tonight is one that gives us a lot of strength and ammunition for addressing substance use on the island among the teenagers. So Janina.
Thank you. I need to orient myself to my audience because when I speak to a group, I want to know who I'm talking to. Who here is a teacher? Okay. Who here is a therapist? One therapist, a clinician, a physician? Parents? Yeah. A lot of parents. Okay. All right. I got it. I got the audience. Nurse. A nurse. Good. A nurse. Well, I'm a member of the Vineyard House, and the following individuals are also members of the Vineyard House. I feel pretty honored to be a part of that group. They are very passionate on trying to help this island with substance abuse. And clearly all of you know, probably it's one of the reasons you're in this room, is that it's pretty flagrant on the island. We've got a serious problem with substance disorder, especially amongst your youth. So I've prepared this lecture to talk to you about youth and the neurobiology of addiction and how that actually forms. And I think that if you could understand some of that, it might help with some preventative stuff with your children. All right. So again, you know, my name is Janina Kean. I'm a psychiatric nurse practitioner. I'm the president and CEO of a place called High Watch Recovery Center. And it's the oldest treatment center in the world. It's based on 12-step principles. It was started by Bill Wilson in 1940. And it was very AA-oriented. And then I came along, and I was looking at this facility with medical eyes, and I had a lot of cognitive dissonance. And I said, oh, my God, we got to do more than just, you know, not teach them not to drink and go to meetings. And I put in a medical model to the facility. So we now have a medical team. We have Dr. Arcuni, who's heading our whole clinical team. He's been a psychiatrist for 40 years. He's board certified in addiction medicine. And so at High Watch, not only did we keep the core, which is the 12 steps of recovery, but we've embedded the neurobiology of addiction in the 12 steps and taking care of our patients in that manner, as well as taking care of any co-occurring disorder. Because it is very common that psychiatric disorder does not sit alone. It sits with substance, and substance doesn't sit alone. It sits with psychiatric disorder, and that's called co-occurring disorders. And I have my Master's of Science from Yale, and I have my Bachelor's from Trinity, and I have no affiliation with any drug companies or agencies. Well, no, yeah, it's important to say. I have no hidden agenda, I guess is another way to say it. This is where I work, which is a very beautiful place. It's 204 acres in the Litchfield Hills.
So bad for you.
Yeah, I have a hard life. So the title of this lecture is Addiction. Their brains never had a chance. Use, abuse, and addiction in adolescence, is it really worth the risk? One of the things that, and I've been at Highwatch for 13 years now, and I have to tell you that the patient that presented to me 13 years ago was a middle-aged man. His family was intact, his job was intact, he drank too much alcohol, we treated him and he went on his merry way. The landscape of addiction has changed dramatically in 13 years. I started to see a progression where I was seeing polysubstance abuse in this 50, 60, 70-year-old. They were doing crack cocaine and they were doing heroin. So that's when it began to change a bit. I never had young adults there. Maybe I had a 78-bed facility, maybe I had one, maybe two young adults. When I say young adults, I call them my kids, and anybody under 30 is my kid. Now, a third of my population is under 25 years old. And they are so ill, ladies and gentlemen, I can't begin to tell you. And that, a little bit, I'm going to weave through why they are so ill and what we're starting to see in the addiction field. One of my young patients at one time, she said, cigarettes brought me to weed, weed brought me to alcohol, alcohol brought me to crank, crank brought me to shrooms, shrooms brought me to coke, and coke brought me to the decision to stop it all. She was 13 when she stopped. Last year, we witnessed the largest number of adolescents in American history who suffered from addiction. Today, there are 400,000 teenagers in need of substance abuse treatment, and they're not getting it. Addiction, ladies and gentlemen, is defined as a chronic relapsing brain disease. And the reason it's a brain disease is because when you take alcohol or drugs, you affect the brain. Usually, it starts out as a voluntary basis. There's a line that gets crossed. The physical changes start taking over in the brain, the drug takes over, and voila, you have the making of someone with addictive disorder. Addiction is a disease of the brain, and the associated abnormal behavior is a dysfunction of brain tissue. And this is something in our society we have trouble finding. He's lying all the time. It's driving me crazy. Well, yeah, his brain. Well, he said he'll only have one drink or he won't do it. I sent him to treatment for 30 days. Why is he high again? His brain. It's about his brain, ladies and gentlemen. When I first understood this concept, it was in 2000, and I was in Texas, and I was at an addictions conference where a lot of the people who did research in addiction, some of the gurus in our country, started presenting what addiction really was, and they were starting to talk about this as a brain disease. And I started to view my patients who were chronic relapsers in a very different way than I did prior. They became, in my eyes, the warriors. They, ladies and gentlemen, were people who had such bad brain disease, yet they had the guts, they had the courage to keep coming back and trying. When you see patients or students who are getting treatment and over and over and over again, they have a desire to be well, but they can't stay well. It's the brain that's causing that to happen. And I'll show you, I have a few slides. An organism functions, the brain functions by metabolizing glucose in each of the cells. And in where you see the red and the yellow, that's the highest of use of the metabolism of the glucose. This is a healthy brain. You're seeing it darker here, and that's because that's a brain diseased by the use of cocaine, where a lot of the brain tissue is not functioning anymore. It's not metabolizing the glucose. And it's the same like a healthy heart. Here's a healthy heart. You're seeing a lot of red and yellow. That's showing tissue functioning properly. And then you're seeing some darkness in the diseased heart. Addiction is chronic disease. It's like diabetes. It's like heart disease. And chronic disease is marked by periods of remission, you do well, and then periods of exacerbation where you get sick again. What we teach our patients at Highwatch is do not feel ashamed of this. If you had asthma and you were taking your inhalers and they weren't working, what would you do? You would go to the emergency room and they would give you some Solucortef and epinephrine and some breathing treatments, and your asthma would go into remission again. But the same concept applies to alcoholism and drug abuse. If you relapse, you got to go into treatment if you can't pull it back together vis-a-vis a 12-step program. You have to go somewhere to get treatment. Otherwise, it just progresses. But the shame of addiction, people won't do it. They don't go into treatment. They're hiding it, they're protecting it. And our society's not helping, because we get mad at them. Addiction is a disease of the brain, and the associated abnormal behavior is a result of the dysfunction of the brain tissue, and I said that already. Sorry. All right, here's, now this is not a diseased brain. This is a normal brain that took cocaine. So look at the activity without the cocaine, okay? Same brain. See how it's diminishing in the red? It's decreasing in the glucose metabolism that the nerve cells are using. And that is not, again, a diseased brain, it's a normal brain. Now this is a diseased brain. This is a brain that has a normal brain versus a brain that has been a long-term methamphetamine user. It looks like there's holes in the brain, but actually what it is atrophying. There's a shrinkage of the brain tissue. Pretty sad, isn't it? Now, if you look at that brain, how do you think that human beings function? Screaming to get high. He's screaming to resupply those dopamine levels that are completely diminished, if not absent. The abnormal behavior that we're seeing in addiction is that compulsive drug-seeking use despite harmful consequences. And I can't say this enough, and I know I put this in because I do a lot of lecturing to adolescents. I teach, we have a lot of private schools up in where I live in northwest corner of Connecticut. And they're always, well, I only do it on weekends, or I don't, blah, 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 blah. You know, it's always sort of this rationalization. The issue isn't the quantity of the use or the frequency of the use. The issue is the consequence of the use. Addiction serves a very important purpose in a human being's life. It allows them to avoid negative emotion. It allows them to anesthetize the pain that they're feeling emotionally without the substance. Hallmarks of any addiction, whether it's drugs or alcohol or process addiction. By the way, if you have any questions, you're more than welcome to ask me. Process addiction, gambling, sex addiction. There's compulsive behavior, there's impaired control, there's persistence in getting to the activity or the substance, there's irritability when not engaged in the activity or the substance, there's relapse back into the activity or the substance, and there's the phenomenon of craving. And the phenomenon of craving in human beings with addictive disorder is that there's dopamine depletion in the limbic system of the brain, and the limbic system, which is our pleasure center, is saying, I want dopamine. Give me dopamine. And that's what causes people to relapse. Substance abuse, it's estimated that 1 in 5 teenagers, 4.3 million, are currently alcohol drinkers. Of adults who started drinking before the age of 15, 40% have developed signs of alcohol addiction. Scary stats, huh? On the average, young people drink 5 drinks on a single occasion, and it's called binge drinking, and binge drinking can be fatal. 1 in 13 teenagers, 1.7 million teenagers in the United States are binge drinkers. Some of the demographics for substance abuse, it's highest in males. It's highest in our region, the northeast part of the United States. 46% of seniors have used illicit drugs in the last year. In 2008, they showed that 10 23.9% of 8th graders use drugs, 23.9% of 10th graders use drugs, and 32.4% of 12th graders use drugs. The most common drug use was Vicodin. Guess where they're getting it?
Can I tell you that on the island, our statistics are probably double that. Except for the 8th graders, our statistics are significantly higher than what we're showing there. And that's over 10 years of longitudinal
Studies.
study.
That's frightening. That's really frightening.
Maybe not quite double, but it's at least, it isn't 12th graders. Yeah, I guess it is close to double.
Where do you think the kids are getting Vicodin?
What is Vicodin?
Vicodin is a painkiller. It's an opiate. Did I hear medicine cabinet?
Yeah.
That's correct. The kids are getting it from their parents' medicine cabinet. And guess where the parents are getting it? Oral surgeons and dentists. That's the largest prescriber of opiates. Why do they take drugs? They feel good. They feel better. They try to do better. They're curious, or they're imitating their parents. And I want to tell you a story in terms of parents. This just happened recently. Sometimes things happen in my profession, and it's like you can't shed them. You can't get rid of them. You carry them on your person for a while. I treated this young boy who was 19 years old, and he was a heroin addict, and his parents were desperate because they were really poor, and they didn't have the means to bring him to High Watch. I had met them at some function in our town. So I suggested for them to come, and we have a program where if you're really financially destitute, we will just treat you for free. And we did that for this young man, and I met with the parents because they wanted to meet with me on more than one occasion. I treat, by the way, in my role as CEO, and I hate administration, frankly. I'm a bedside nurse, so I teach and I see patients one-on-one. And I saw that this family because they met me in the world, and they wanted to say, oh, please, talk to us. And I talked with these parents, and I never found out this one bit of information because they kept it a secret. Anyway, he ended up overdosing and dying. The father didn't come, but the mother wanted to come to me and thank me again for being kind to the family and helping her. And that's when she disclosed to me that the father had been, throughout their marriage, a marijuana smoker. So here was this family with a father who was abusing cannabis. The son, and the father sat in these family therapy sessions with me, denied the whole thing, because I asked them about their relationship with substance. I just like this kid a lot. It just really bothers me. Environmental factors that increase the risk of use of substances in teens are home, family, peer, school, and other factors that play into substance use is the method of administration, early use, and gender. Women, by the way, will be more affected by substance than men. If you could actually take a woman and a man, they start at the same age, and they drink for drink, she will be sicker sooner. For example, with alcohol, the first pass of alcohol in a human being is in the stomach, and there's an enzyme in the stomach called alcohol dehydrogenase, and it breaks down the first pass of alcohol. In women, that's really diminished. So what happens is women end up with higher blood alcohol concentrations when they drink, whereas men have still the alcohol dehydrogenase. It's more prevalent in them, so they're at least doing the first pass of alcohol. Now, do you think I see them first?
No.
I see them at end-stage addiction. And the reason I see them at end-stage addiction is women, what are we? We're containers of babies, right? We carry babies. We are mothers. We can't drink. We can't drug. The shame for women is immense. Then many times women are dependent. They're dependent on their spouse financially, emotionally, or he's using too. And he's very vested in her staying sick with him. So we get them much later than we get our men. Okay, so I'm going to talk a little bit about brain anatomy. These brain cells communicate with each other. These are two nerve cells, neurons, and they communicate in this spot right here where that red arrow is, and that's called the synaptic space. They communicate through their axons and dendrites, and they use what they call neurotransmitters to speak from one cell to the next. And in the process of doing that in our brain, we create different circuitries. The circuitry that I'm going to talk, well, I won't say that yet, I'll just confuse you. The brain weighs about 3 pounds, and it's made of trillions of nerve cells, these neurons. Again, it's through the synapses that they communicate with each other, the nerve cells, and they do that with neurotransmitters. There's 2 myths. First, that drug use is a matter of choice. Remember who said that? Just say no. Nancy Reagan. Yeah. Just say no to that brain that was atrophied, right? And that addiction is genetic. And this is the part that's going to be provocative. Because we always thought about addiction as genetic loading. And I'm here to tell you that there is a genetic component to it. But the environment must turn it on. If the environment doesn't turn it on, it doesn't have to happen. And this is a very important point, ladies and gentlemen. And actually really sort of the whole core of what I'm going to talk to you about. What do we have to do to not turn it on? How are we turning on this genetic component? And both myths, I feel, it takes our society off the hook. Stanley Greenspan, he was a child psychiatrist from the U.S. National Institute of Mental Health. He stated, if our society were to truly appreciate the significance of children's emotional ties throughout the first years of life, it would no longer tolerate children growing up or parents having to struggle in situations that cannot possibly nourish healthy growth. And think about our society, how many people in our society, parents, how stressed we are, what's going on in the world, people losing their jobs, single parenting, the stress that causes the primary caregiver. All right, so now I'm going to take you through this step by step. There are 2 times in a human being's life where we develop the brain power. Obviously in utero, but also 90% of the size of the brain develops in the first 3 years of life. And think about it. If the brain was as big as it needed to be, the skull would be large, and how would you get through that birth canal? So God made us this way so that we could get through a birth canal. And the other part of where we develop brain power is between the ages of 10 and 21. Now this is when, and this is the reason, the second statement, is the reason that I'm seeing the kids as sick as they are. When I meet with the children, and children under 30, and I do a history on their substance use. I ask them how old were they the first time they got high? 9, 10, 11. Well, it was my parents' party, and there were glasses left, and I tried it, and it felt good. I treat kids who are doing crack cocaine at 12 and 13. Hallucinogens. And so what's happening in that adolescent, in that period of time between 10 and 12, it's the fine circuitry is forming. It's sort of like pruning that happens. And they go from using judgment to the amygdala, which is in the limbic system, it's a very emotional part of the brain. They transfer that to the prefrontal cortex. That's why when you see teenagers, They make really bizarre decisions. You know how many kids, it's like, oh my God, that adolescent egocentrism that you see. It's because they have not formed yet the circuitry, ladies and gentlemen, to the prefrontal cortex. Now, what is the prefrontal cortex? That's executive functioning. It allows me impulse control. It allows me to adhere to a plan. It allows me to do sequential order. I need those things. And say if you have a substance abuse disorder and you messed up your prefrontal cortex, you have no impulse control, you can't adhere to a plan, you can't do things in sequential order, how do they stay sober? But teens are never even forming the circuitry because they're using, at the time when the circuitry is supposed to develop, yes.
I'm focusing on point number 2, between the ages of 10 and 21 when the brain develops the electrical and chemical circuitry. And I'm thinking about...
the fine pruning of it.
Well, and I'm thinking about prescription drugs, not taken from your parents, but prescribed drugs for the child, and more specifically attention deficit disorder and Prozac or Adderall or whatever other brand. I'm going through a decision now with my son, and he's 9, coming right into that 10 to 21 age, and I'm told a couple of things. And I go on the internet and I read, so now I'm completely confused. And it's addiction, or what it does during that stage in number 2 is 10 to 21. And the idea comes, well, you can try this or that, or a balance of this, or
Your child has attention deficit hyperactive disorder?
Yes.
Is that the diagnosis?
I believe EDD.
Okay, attention deficit disorder. And so they're talking about treatment to be Concerta, Adderall, is that correct?
Yeah, I mean, it could be one of them, sure, I
Okay.
guess. But then the idea being you can try it, and if it doesn't work out, we'll just stop it and things. But isn't it a highly addictive drug, and isn't it during the developmental stage that really just even trying it could be damage?
I think when I'm done with my lecture, you'll have answered this question.
Okay.
You have to have the neurochemistry for addiction. And you'll see what I mean. If a child or if a human being has attention deficit disorder, or if they have major depressive disorder, if they have anxiety disorder, those are painful things to have. And they will find ways to medicate those symptoms. Doesn't always make them an addict, but they will need something. A lot of people drink alcohol for anxiety disorder, major depressive disorder. And these are my kids who are addicts, but cocaine helps ADD, as does marijuana. It allows them to focus. A non-addicting drug that you might think about is, has anybody mentioned Strattera or Wellbutrin? Because those are 2 non-addicting drugs that you might think about exploring. And one of my professors, this was his specialty at Yale, Dr. Larry Scahill. Look him up. Or email him. He's at Yale University.
It's too bad there wasn't a test out there to identify if someone is predisposed to an addictive disorder
That's correct.
before giving that kind of medication.
Right. That's
And
correct.
if you knew whether or not you had an addicted brain, then you'd know that wasn't the choice. I don't believe that you can test
Yeah, that's
No.
correct. There is no
it. No,
test.
that's what I was saying. It's too bad you can't.
So the brain development in utero and during childhood determines the predisposition to addiction, ladies and gentlemen. The expression of genetic potential is contingent on the environment.
Going back to the environment being what flips the switch. If you have two parents, they raise 4 kids. 2 out of those 4 kids are addicts. 2 aren't.
I'm going to answer the question.
Go ahead. How do you explain?
This lecture, I think, should answer the question. So, as I said, of all the mammals, we have the least mature brain at birth. I mean, think about little dogs, little cats, horses. They can walk. How old are they when they can walk? How long does it take us to get to that point? So 3/4 of our brain develops after birth, and as I said to you before, a 3-year-old has 90% of its brain volume. So what I'm saying is that in those first 3 years of life, you're setting the foundation for the brain. We're born with billions more neurons and connections than we need. During the early years of growth, the brain will select those nerve cells, synapses, and circuits that help the brain adapt to its particular environment and discards the rest. Certain connections and circuitries are strengthened while others are pruned out. This is called synaptic pruning. This pruning allows the brain to shape into an organ that governs action, thought, learning, relationships, and a multitude of other tasks to coordinate them all in the human being's best interest.
Can I ask you a question?
Yes, please.
I'm a little confused. Could you please explain to me, are we all susceptible to becoming addicted?
Yes.
Okay,
There's a possibility, depending on what happens in those first 3 years of life.
the first 3 years of
Especially the first 3 years of life. Although, I've been hearing some research from NIDA where they're starting to think about adolescents who had non-addictive brains are forming addictive brains.
Okay.
But that's
I guess like where I'm a little confused is take meth.
methamphetamine.
If I took meth, aren't I then just addicted?
No.
I've heard if you try it once.
No, that's not correct.
Oh, okay.
How about if she tried it every day for a year?
She'd have much fresher brains.
No, but
Just because I'm
she tries it every day for a year, but she was one of the fortunate ones who avoided that, the addiction,
pre-exposure of.
so, but since she smokes it every day, she's hooked.
Yeah,
Right.
you know.
Is that what you're doing?
Or at the end, or at the end of the year, does she just say, well, I'm not on
There's a
this
difference between addiction and tolerance. I can make anybody tolerant. Here's an example. You got bladder cancer, very painful. I'll give you opiates, and I keep giving you opiates, and the brain adjusts to those opiates. You develop tolerance to the opiates, you need more opiates, you develop a dependency on the opiates. You get really sick if I take the opiates away abruptly. That doesn't mean you're an addict. That doesn't mean when I take, you have created neuroadaptation. The brain has adjusted to the use of those opiates, and the brain will react if you take them away. But when I decrease the opiates and detox the person from that high use of opiates, doesn't mean he's going to go down to the hood and start finding heroin. He's got to have the predisposition. He's got to have the neurochemistry.
So we all have predispositions to
No.
terrible side effects, but we don't all
Yes.
have predispositions. So at the end of the year of use, some people were able to quit, others, because of this predisposition of early in life.
But I want to
Can't
say,
quit.
I'd like to say to you, like, what's going on in a human being's life if they have to take methamphetamine? Like, what's that about? You know, or
Some kind of trauma or.
yeah. Well, I mean, I'm talking just recreational. What's that about? What's it about to take crack cocaine? What's it about to be smoking? You know, I mean, and I'm not going to get into the politics of that. But what is that about for a human being? What are you doing? I ask. Dr. Robert Post, he's the chief biological psychiatrist of the psychiatric branch of the United States National Institute of Mental Health. He states that infants in their early years, at any point in the developmental process, you have the potential for good or bad stimulation. And it is precisely here where the problem arises for young children who will, in adolescence and beyond, become chronically addicted to drugs. In many cases, though, it's not, ladies and gentlemen, it's an important point, it's not a question of bad stimulation. So I don't want you to feel as a parent, if you have a kid with a substance abuse problem, you did them wrong. But a lack of sufficient good stimulation. Maybe that child needed more good stimulation. And all organisms are different. For optimum brain development, you require good nutrition, you require physical security, and you require constant emotional nurturing. Human connections make neural connections in those first 3 years of life. The child needs to be in an attached relationship with at least one reliable, available, protective, psychologically present, and reasonably non-stressed adult.
You're asking a lot.
And what's our society about? We're stressed to the max. That's the formula, ladies and gentlemen. The areas that are disrupted in addiction are actually the areas that are developing for normal processing of pleasure reward system, motivation incentive system, and our self-regulation system. Those are the three areas of the brain that we need for human life, by the way, that get disrupted in addiction. And a lot of it centers all in the midbrain and the limbic system. The limbic system is your reward center of the brain. It's the emotional part of the brain. It exists for human survival. It processes emotions like love, joy, pleasure, pain, anger, fear. It is the center for sex, eating, emotional pleasure. Emotions exist to initiate and maintain activities necessary to survival. The limbic system modulates two drives essential to life: attachment and aversion. The limbic system is where alcohol and drugs of abuse respond, because drugs of abuse resemble our own natural brain chemicals. All drugs of abuse target the brain's reward system by flooding the circuitry with the chemical dopamine. Dopamine is the granddaddy of it all. When drugs of abuse are taken, they release 2 to 10 times the amount of dopamine that natural rewards would release, like eating, sex, beautiful music, the beach. This excessive dopamine in this system produces the high that drugs can cause and teaches people to repeat the behavior, dwarfing the effects produced by naturally rewarding behaviors. The effect of such a powerful reward strongly motivates people to take drugs again and again. However, just as we turn down the volume on a radio that is too loud, the brain adjusts to the presence of the excess dopamine so that without the drug, the ability to experience any pleasure is reduced. Now they need to take drugs just to bring the dopamine function back to normal, and they must take larger amounts of drugs than they did first to create the previous high. That's why they're always chasing it. And what they're finding in research now is that the limbic system becomes what they call sensitized. This is after long-term use of substance. So we bring the person into treatment, we sober them up, we send them back out in the world, and I've heard the story, ladies and gentlemen, more times than I can even repeat. He talks about going to Cumberland Farms to get milk, and instead he makes a left and goes into the liquor store and starts drinking a bottle of vodka, and he doesn't know why. And he comes back to treatment. I see this over and over and over again. The child is doing really well on his way to school and says, the heck with it, I'm going to go down the street at that crack cocaine house instead. And he's there, and there's no thought process to it. He just finds himself there. I'll tell you why. In normal, non-addictive brains, when you're releasing the dopamine, you're not releasing it to the effect you may be releasing it in an addictive brain. It's maybe surging a little bit slower. And it gets reuptaked. It gets removed from the system a little bit slower. In a person with the potential for addictive disorder, it surges it. That's that high, that great feeling that they feel. But it reuptakes it just as quickly. And that gives them the phenomena of craving that says, give me more dopamine. But what it's translating to, and what you're seeing is he can't stop drinking. He just had 23 beers. But really it's the brain saying, more dopamine, more dopamine, more dopamine, more dopamine. Now we sober him up, we bring him to treatment, he's sober. The wife is thrilled. I keep talking about he, is he, I'm being really biased here. She sobers up. And we send her back to the vineyard to her lovely family. And the next thing you know, the husband's calling me up and says she's drunk again. This is probably what happened. Two things will trigger this off. Environmental cues or stress. What both of those will do is they will surge the limbic system with the dopamine as if you took a drink or a drug to that intensity. It gets reuptaked. The brain says, give me more dopamine. And the person finds themselves using without any thought process. It's called sensitization. And what they're finding is that the brain needs to reset itself. So they're talking about treatment being now around 100 days, because what they're finding is after the 100th day, you're seeing better brain activity. In other words, you're seeing more glucose metabolism in the brain. That explains relapse. So picture that human being who has that kind of sensitization of the brain, who really doesn't want to lose her kids, who really doesn't want to lose her job, yet she finds herself high again and again and again. You know, I see this with mothers. Mothers don't want to lose their kids, yet they're threatened with, if you keep, DCF will come and get them, yet they're high over and over again, and they're devastated by this. It's because their brain has gotten that sick. There are three major networks that we'll talk about that are involved with the brain, are implicated in addiction. The first is the pleasure reward system, which is your opiate system, and that's in our limbic system. The second is your incentive motivation system. That's also in the limbic system, and that's our dopamine system. The other is a self-regulation system, which is your prefrontal cortex. Remember, I talked about that with the adolescent who was, still using the amygdala for decision-making and has to transfer that decision-making from that amygdala to the prefrontal cortex. And then finally, there's one brain-body system implicated in addiction, and that's the stress response mechanism. Let's start with the opiate reward system. Opiate system is responsible for pleasurable and joyful excitement. It's the natural template for feelings of reward, soothingness, and connectiveness. Positive expectations turn this system on. Opiate circuitry provides powerful soothers for physical pain as well as emotional pain. When physical or emotional pain is felt, opiates are released in the limbic system. Opiate system is the catalyst for the key emotions of human life. It enables emotional bonding between infant and caregiver. For example, as the mother nurtures her infant, she's releasing opiates. She's feeling pleasure as she's rocking and coddling her baby. Her baby is releasing opiates and feeling pleasure in the coddling and the rocking that he's receiving from the mother. This process, as it continues, will eventually allow the infant, during separation from the mother, to release small doses of the opiates to soothe away the separation anxiety. Parents' loving response to their baby's discomfort floods the infant's brain with opiates. This promotes attachment and further develops the opiate system. If the parent does not respond, the infant is left to its own inadequate coping mechanisms, rocking, sucking. But it's not, the opiate system is not forming properly. You know what my opiate addicts say so often to me when they get high? I said, so what's it feel like? They said it's like your mother's love. It's like being wrapped up in a cocoon. It's like being wrapped up in a security blanket. It's this incredible sense of warmth and comfort they feel. They get that over and over and over again. If an infant that is in a frequent state of stress, if an infant is in a frequent state of stress, it will decrease the number of opiate receptor sites that the child develops. Because remember, that first 3 years of life, it's doing that synaptic pruning. It's developing its opiate receptor sites. It's developing its dopamine receptor sites. So if it's not getting that interaction, the dance that needs to happen between parent and baby, or caregiver and baby, it will not develop appropriate number of opiate receptor sites. If the infant does not receive constant secure interactions, or worse, exposes him to painful ones, brain maladaptation often results. These children are at a greater risk for seeking chemical satisfaction from external sources later in life. Addiction to opiates like morphine and heroin arises in a brain system that governs the most powerful of human emotion, the attachment instinct, love. Yes?
Your last slide, do you have a recommendation in the book or something that might be beneficial to a parent with adopted children that probably have those issues?
The adopted parent has the issues, or whether the
Child that I adopted probably has those. And so if they weren't born,
you had a kid who's predisposed.
right.
Yeah, and especially if you don't get that, if you don't know what happened to that infant in utero, or if you get that infant at a later stage, a 1-year-old or a 2-year-old, at 5 years
5 or
old,
7, yeah.
it could be problematic.
So do you have any book recommendations or any resources? Or things to watch, or, I mean, obviously it's a lot of love and a lot of communication.
I'm going to get into that in the end, if I ever
So
get to
maybe
the
we'll
end.
get back.
I need to get to the end.
Yeah.
For your sake, I need to get to the end. You can only listen to me for so long. I will answer that for you.
Okay, no worries.
All right, so any questions about the opiate system?
Is anyone cold in the room?
Yes, oh yeah, keep it close. I did that because I was,
Are you cold? Sorry.
I'm good now, yeah. The next system is the dopamine system. That, again, is one of the systems implicated in addiction. And it's the incentive motivation system, and it exists for the purpose of survival-related behavior. This system gives rise to intense feelings of elation. It involves life's essential reinforcers, food and sex. This system is located in the ventricle tegmental apparatus, or they call it the VTA, and it's found in the midbrain. The VTA gets its power from dopamine. The VTA is associated with many brain circuitries that trigger the dopamine to the nucleus accumbens. All drugs of abuse rise dopamine in the nucleus accumbens, cocaine most dramatically. You know which method of using cocaine will do it the quickest? Injecting? Smoking. So dopamine levels in a baby's brain fluctuate depending on the presence or absence of caregivers again. Long-term absence of caregivers during the child's development causes a decrease in the formation of dopamine receptor sites in the incentive motivation system. This plays a key role in the onset of addiction and craving. And by the way, ladies and gentlemen, it doesn't have to be the parent, but it has to be a consistent caregiver. A consistent, loving caregiver. It doesn't have to be the parent. Sudden increases in dopamine and, again, the nucleus accumbens set off the excitement and elation experienced by drug users. This can occur with environmental cues that I told you about earlier. Novelty seeking and risky behavior will increase dopamine. Chronic drug use decreases the dopamine receptors and drives addicts to use the drugs to make up for the loss of dopamine activity. You know, you'll hear, like, my patients will say, you know, looking for the money or stealing the money or driving to the hood, they're getting as high as if they were using the substance. Parents' mood and stress levels determine the quality of the contact between caregivers and infants. All infants need sensory stimulation to survive because they do not have the mechanism to regulate their own stress. Caregivers provide this by holding, coddling, stroking. Children who are ignored and rarely handled can develop a condition called failure to thrive, which can lead to death. The quality of the relationship between the caregiver and the infant also helps develop GABA receptor sites, which are, like, anybody in here do yoga? Yoga is a great exercise. It releases tons of GABA. It's the soothing neurotransmitter.
Can I add that yoga is our next lecture piece? And it will be at the Yoga Barn in March. Thank you.
Thank you. The children who don't develop appropriate GABA receptor sites are more prone to addiction to benzodiazepine, as well as alcohol, because alcohol affects two receptor sites, GABA and glutamate. That's why it always horrifies me when I see recovering alcoholics, and I've seen this a lot too, who go to their physician because they have anxiety disorder. So what does the physician do? He doesn't give them a high level of an antidepressant. No, he gives them benzodiazepines. And what does he do? He starts triggering off all the GABA receptor sites. And I have treated many alcoholic men and women who have had long-term sobriety, given benzodiazepines, and have relapsed. Heartbreaking. And it infuriates Dr. Arcuni, my
How come
addiction.
doctors don't know about that, or why don't?
They have no experience in medical school on addiction. They get very, very little. We actually are very proud of this. We have a relationship with University of Vermont Medical School. And what's today, Wednesday? Tuesday was my first medical student in the history of High Watch Recovery Center, so we're now taking in medical students. We also have a contract with Yale University, and we're taking in nurse practitioners, student nurse practitioners, so we're becoming more of a teaching center. But I want to see more physicians. Physicians are there any physicians in the room? Very ignorant. They are. They relapse my patients again and again. Dr. Arcuni, he's doing a lot of grand rounds, as I am too, to the different hospitals. We are trying to educate physicians on how they should appropriately medicate patients who are in remission with addictive disorder, because what they'll give can determine whether they'll relapse or not. Very frustrating. Okay. Parents' nurturing helps develop also serotonin receptor sites. The absence of serotonin increases the likelihood of developing depression, aggression, and an increase to using alcohol. Caregiving deprivation causes a decreased production of our love chemical, oxytocin. Oxytocin is essential to form committed relationships. When mothers give birth, they release tons of oxytocin in the brain. When, boy meets girl on Martha's Vineyard, and, you can't stop the love that strong. It's tons of oxytocin that's getting released. It's the attachment neurotransmitter. So adults with difficulty forming committed relationships are at higher risk to turn to substance as a social lubricant if this neurotransmitter didn't properly get formed. Now any questions about incentive motivation? We're going to the third system, and this is where adolescents really play a part. This is the self-regulation circuitry. the prefrontal cortex. Cortex, ladies and gentlemen, it means bark. And the cerebral cortex covers the rest of the brain like bark covers a tree. One of the later evolving parts of the cortex that distinguishes us from other animals is the frontal cortex, and particularly the prefrontal portion, which acts as our executive officer of the brain. The prefrontal cortex is where emotionally driven impulses to act are evaluated and are either given permission to go ahead or it says stop. It's your brake system. Most of the work of the prefrontal cortex is to inhibit inappropriate response rather than to produce the appropriate one. I said that wrong, didn't I? Most of the work of the prefrontal cortex is to inhibit inappropriate response. Many studies linking to addiction find, actually there's a very specific part, and it's located behind the eye. It's called the orbital frontal cortex, is not formed properly in addictive disorder. So in the self-regulating circuitry, these circuits help to formulate decision and regulate impulse. As we mature, these higher brain circuits develop and can then exert control over our lower circuitries. These circuits are necessary for those who suffer from addiction to choose not to use drugs. Evidence shows repeated drug use leads to long-lasting change in these circuitries. So we're seeing a lot of problems in prefrontal cortex, especially with alcoholics. And they're starting to do some research on Alcoholics Anonymous. And they're suspecting that brain circuitry is redeveloping in the simplicity of that 12-step program. They're also suggesting, some of the research, that the dynamics of the group are acting as the prefrontal cortex, the judgment area for the person newly sober. So in a teen brain, to the left, that's the amygdala, that's where they're making decisions, and you hope that they will develop into the prefrontal cortex that they can use as their judgment and decision making. If that teen is using substance, even in a recreational use, they're going to mess up this circuitry.
When you say recreational use, how few times or once? Does that,
Once ever in their whole life? Probably not, but on a fairly regular basis, sure. Sure. Because it's essential that they transfer, and it's during that, remember, that's the second time of brain power, 11 to 21. It's essential that those kids form that circuitry, because they won't get impulse control, they can't do things in sequential order, their judgment will be poor. Yes, sir?
I think this is just repeating the same question I had earlier. So
Okay.
you're talking about the question, the brain on the left, you start your child on Prozac, and at the
No.
same time they're trying to move to the brain
Not
on
on
the right.
Prozac.
On any of those types
Drugs of
drugs.
abuse. No, drugs of abuse.
Drugs of abuse, so those
I'm
odd
talking.
prescriptions and,
No. I'm talking about drugs that are going to affect the dopamine circuitry, the opiate circuitry, drugs of abuse I'm talking about.
So the drugs I'm speaking of won't affect the brain changes.
Concerta might, there's a lot of controversy in that. There's Concerta and Ritalin for ADD may, yes.
Okay, it may affect that development. You only get one shot at it, I imagine, from age 11 to 20, is what you're saying.
And again, you may want to explore Strattera and Wellbutrin for your sons to be able to focus.
And they've been able to determine that wouldn't affect this transition from the teen brain to the adult brain?
It depends on what research you read.
Yeah. That's back to the internet, I get confused again. It's
Larry
just not that
Scahill,
clear.
yeah. Larry Scahill, Dr. Scahill. That's his specialty. So, in the self-regulating system, or that orbital frontal cortex behind the eye, there's abundant supply of opioid and dopamine receptors. In mature adults, it's the highest arbitrator of their emotional life. The OFC is powerfully affected by drugs and powerfully reinforces drug habit. It's the apex of the emotional brain. It is the mission control center. It is embedded with neurological tracings of formative years. It decides the emotional value of external stimuli. It allows you, that system is looking at your pupils, the person who's sitting in front of you, their body language. It's picking up all sorts of information and transferring it to the brain. Yes?
But did you say earlier that this place right here,
OFC.
is if a child started at 12 or 13 and was a regular drinker or marijuana or whatever, any drug, are you saying that thing is not developing?
It's
that
not.
That has impacted the ability of the body to develop it appropriately?
That's correct.
So it's not even there.
Well, it's
Or,
there
I mean,
in
it's
more
there.
rudimentary forms, but it needs to it needs to fine tune. It's like pruning a rose bush. To make it more beautiful, it needs to clip off here and add to here and grow there.
So is that why the drinking age is 21?
I don't know. That's probably a political issue.
I'm saying if, like, you know, your numbers are the age parameters, then it's the 18, right?
Yeah.
I mean, it
Yeah.
must make.
Well, I think the studies were showing that lots of bad stuff were happening to kids at 18 years old, and so they moved it, because it was 21 and then they moved it to 18 and then they moved it back to 21. Kids still, at 18, they're still not in a position to make good choices yet.
Right.
So this OFC, it influences emotional and social behavior, including attachment and love. It interprets emotional contexts of communication, body language, eye movement, tone of voice. It inhibits impulses that if we acted out would be harmful, such as inappropriate anger, violence. In those with substance abuse disorder, it undervalues food, health, relationships, and overvalues drugs of abuse, drugs of choice. When the prefrontal cortex gets damaged from repeated drug use, the individual loses impulse control and does not have the ability to say no to drugs. It's impossible. So in summary, the self-regulation system, you got the opiates, which consummate our reward-seeking activity by giving us pleasure. And dopamine initiates these activities in the first place. So our incentive motivation system initiates us to seek pleasure. Powerful incentives and pleasure reward mechanisms drive the craving for drugs, but the system that normally inhibits the whole mess has gone awry, that prefrontal cortex. So you got three parts that are, you got your opiate system that is in trouble, you've got your incentive motivation or your dopamine system that's in trouble, and you got your prefrontal cortex that's in trouble. Yes.
It sounds like there's an incentive buried there for adolescents in terms of bad stuff happens when your prefrontal cortex doesn't develop properly.
That's right.
But it's not a black and white situation. There are shades of gray, depending on consumption and so on and so forth. But and I know a lot of grown-ups walking around with underdeveloped prefrontal cortexes. And a lot of that I also know is attributable to heavy-duty substance use during that period.
Or say you didn't start drinking until you're 21, 22, and it's all formed, but you have the propensity towards it. You can mess up from long-term substance use the prefrontal cortex. You could either not acquire it in adolescence because the adolescence is using, or you could ruin it in adulthood if it was okay from long-term drug or alcohol use.
I was just saying it could be an incentive to young people because of the penalty. In other words, the downside is pretty significant. So therefore, that's another incentive to try and avoid.
And you don't know. See, that's the problem. You don't know. You don't know if that you have the right circuitry. You could come from a family that might just had been overstressed. You don't know. There's no test. Maternal deprivation, let's talk a little bit about this. This is the mind-body. Now, I've talked to you about the brain response mechanisms that are implicated in addiction. This is body, mind system, and our last system. Are you guys getting tired? You sure? Okay. Maternal deprivation causes high levels of cortisol in the infant, which affects development of dopamine incentive motivation parts of the midbrain and the hippocampus, which is used for memory and processing emotions. Constant high levels of cortisol does not allow the infant's brain to develop a healthy stress response later in life. Instead, they develop a lower set point for their internal stress system, causing them to be more easily stressed throughout life. Alcohol gives more pleasure in adulthood because it relieves the stress. Addiction is a deeply engraved response to stress. Addiction becomes the mechanism to self-soothe rather than their own internal system, because their own internal system is inadequate, malformed. A brain that is easily triggered by the stress response will assign a high value to substance. It will have less interest in long-term consequences and more interest in, I need to fix this now. Stress is also a major cause, as I told you earlier on, of continued drug dependency, increases opiate craving and use, enhances the reward effects of drugs, and provokes relapse. A little bit about high watch. I think I told you about high watch. Let me just give you some studies on abuse. Just when I think I heard it all, I hear something worse. High watch is up on a hill. We have this beautiful hill. It's beautiful, and I drive home. It's a 13-mile ride. I go down hills, up hills, down hills. I'm living in Northwest Litchfield Hills. It's just, and I open the windows sometimes to sort of try to get it off of me. I don't know how else to explain it to you. I feel contaminated sometimes by the stories. They're so horrifying. I've read stats anywhere from 75 to 100% of women have been physically, sexually, or emotionally abused sometime in their life, those women who have addictive disorder. It's about 60% for men. Studies on drug addicts show a very high percentage of childhood trauma, including physical, sexual, or emotional abuse. 2/3 of those who inject drugs have had abusive, traumatic childhood events. 50 to 100% of women who suffer from substance abuse have been physically and or sexually abused. And then, of course, when they start using substance, they put themselves in a more vulnerable situation, so they get re-traumatized. Adolescents who have been sexually abused are 3 times more likely to drink. Brains of children that have been mistreated are 7 to 8% smaller and have below average volumes in multiple brain areas. Women who were abused in childhood have a hippocampus that is 15% smaller than the healthy brain. Traumatic events in childhood sabotage the brain's ability to soothe emotional pain. And all those systems that I talked to you about today are affected. Dopamine and opiate receptor sites of the limbic system, impulse control areas of the cortex, the stress apparatus. And you learn how to love by the love you experience from your first caregivers. So if that love was abusive, punitive, pejorical, you will try to replicate by mastering that relationship over and over and over again. I see this a lot in my patients. I wanted to show you that we can get better when we have substance abuse disorder. Here's your normal brain. Remember again, more yellow, more glucose metabolism. Here's a cocaine abuser 10 days after stopping use. See, not too much brain activity happening there. But look what happens after 100 days. Remember how I said it starts to reset itself? This is the early risk signs seen in infancy or early childhood that may predict later drug abuse. And this, I think, will answer the lady's question there. Aggressive behavior, lack of self-control, difficult temperament. As a child gets older, there's trouble with interactions with family, at school, and within the community. Sometimes family situations heighten a child's risk for later drug abuse. For example, when there's a lack of attachment or nurturing by parents or caregivers, ineffective parenting, or a caregiver who abuses drugs himself or herself. But families can provide protection from later drug abuse when there's a strong bond between children and parents, parental involvement in the child's life, and clear limits and consistent enforcement of discipline. Interactions outside the family can involve risks for both children and adolescents, such as poor classroom behavior or social skills, academic failure, and association with drug-abusing peers. Some of the physical signs I've provided for you, and you have those in your handout, so I'm not going to read all those to you. And I also provided some of the behavioral signs that you would look for in your children who might be using substance. So, any other questions?